Good afternoon, everybody. I want to, at outset, thank Dr. Sudhir and Dr. Praveen for arranging this session. Operate this. Yeah, low vision services goal is to integrate people with low vision in the mainstream as productive, independent members of the community who also are contributing to its welfare and progress. So low vision services need to be accessible, affordable, sustainable and also available, but more than anything, comprehensive. So, and the key essentials for this is a service protocol, equipment, necessary infrastructure, and human resources, trained human resources. Comprehensive low vision services has not only a clinical component but also a rehabilitation component, which unfortunately is being missed by eye care people. And the protocol in this is identification and referral, and then for clinical assessment, but we don't stop with interventions also, but we also do functional and educational assessment and follow up the patient and do monitoring of how they are using their interventions. And low vision service delivery is at primary, secondary and tertiary level with different standards and different protocols. So the key words for all this is, it's a holistic approach with a teamwork, a multidisciplinary teamwork, and so there's a lot of networking, and it has to be inclusive. I mean, inclusive means we also include all the other disabilities. So what are the key opportunities here available when we think of comprehensive low vision services are? There is quite a lot of public awareness from the patient's point of view, and there's also improved access to a lot of, we saw the statistics, and regular screening programs are available, subsidized services are available, there are a lot of government schemes, and also educational and rehabilitation support. But from opportunities from service providers, there's increasing need in the community with life expectancy increasing, with children, preterm children surviving, and with ROP and ARMDs and all that. And we also heard about the government programs which are coming up, INGO involvement like CBM is in it, and we also have international guidelines. And we have to a certain extent trained HR, training centers. Joseph I Hospital is also a training center, and devices are available now. We saw some of the devices which are very high tech, and we also can right now think of a little bit on sustainability. But what are the challenges right now from service providers' point of view is there's no standardization. No standardization on management protocol. Every person does what they think is right, but we need to come up with management protocol. We need to have HR criteria. What is the training? What is the knowledge and skills needed at different levels? Equipment, what is the equipment essential for that level of services and infrastructure necessary? And also there's no mapping of services available. What services is available where? Is it just clinical or clinical and rehabilitation or just rehabilitation? And what are the trainings offered across these centers that we saw the number? Is it just rehabilitation or just clinical or both together? And what are the devices which are accessible, the vendors, what are their costs? And what is the support obtainable, especially financial support? From the patient's point of view is, the challenge here is, they have no awareness about available services, so we need to make ourselves felt, seen. And what are the accessible resources, also finances, financial support, sponsors and things like that. And they don't know the importance of proper follow-up protocol. What is the protocol and what is the follow-up? Why is it so necessary? So these are the challenges from that side. So my recommendation is, if you want to start a low vision service, decide to be inclusive, but discern what level of services you are starting and start in a phased manner. Determine how you're going to manage finances, especially not only the service providers but to the patient. How are they going to get the devices? How are they going to access people who can help them with that? And also devise long-term plans for sustainability. Right, on the early stages it's not going to be possible. So unless we use these opportunities, capitalize on them, and the challenges are overcome, comprehensive, I again stress the word comprehensive low vision services will remain a vision only. So I'm just going to show you a few things about a major challenge, which is follow-up in all our centers. And so finding these people after that for follow-up might take you across roads like this. And thanks to CBM support, Joseph I Hospital was able to do some of this. So we had to travel to see them and take all the equipment and the optometrist and me and others. And finally, after crossing all rivers and streams, we found this girl. She's an RP child who almost became a dropout, but with encouragement she has gone on to finish her schooling, but unfortunately her father refused to send her to college. So sometimes you might have to assess them then and there, wherever you find them, and this could be both low, distant vision, near vision, everything. This is in a school where you do both rehabilitation, functional assessment, and maybe talk to the teachers and also the family members. So this is one of the major challenges. So the challenges are there. We have to at each level devise means of finding how to surmount them. Thank you once again. I also want to say that Joseph I Hospital, with the help of CBM, conducts trainings for different cadre involved in low vision, both rehabilitation and clinical. Thank you.